from things then. Dreams.
I must be honest, sometimes it is hard to concentrate on the camera because there are lots of stray cats in the neighborhood, and I'm looking right at the street here and they're so cute. Oh. Hi. Yesterday went so well with the videoing that I thought I would do it again. So today I woke up, I rolled out of bed at 6:30ish, threw on some deodorant and got layered up and went out to my MRI follow-up. Now the place where I'm having my MRI follow-up is a pain management clinic. So they don't really do anything except for physical therapy and pain management. So there isn't going to be someone there to look at images such as x-rays and MRIs and tell you anything beyond really, you're in pain because of this and I will treat your pain. The doctors accessed the report and saw the herniation in the cyst and the lesion. So I asked like, is there any reason for me to get a CT scan for this lesion in the cyst? And he told me no. I asked him, is there any reason for me to get an additional MRI in my thoracic region of my spine? And he said no. Really, I was more concerned with the process of the pain management course that the doctor wants to take. I'll be going in next week on Wednesday to get an epidural steroid injection. The procedure apparently involves them laying me on my side. One doctor said, oh, it's only, 5 or 10 minutes. Another doctor came in later and said, oh, it's like 15, 20 minutes, so it'll take time, is what I've gathered. They inject you first with lidocaine to numb the area, which I was told is the most uncomfortable part, but that's usually a lie when people tell you that. I have learned. It's acidic, so it burns when it goes in the skin, into your flesh. And then with an x-ray machine, the doctor will put the longer needle into my back, and he'll check as he goes with the x-ray every few millimeters, centimeters. He'll take an x-ray and see where the needle is until he believes that he is in the exact correct position that he needs to be in. He'll give me my injection and he's gonna do it on both sides of my spine. I'm kind of freaked out by it, which is a wholly new experience for me. I've never been afraid of needles in my life. It's not a thing, needles. My good friend pointed out that it's probably just the fact that I hurt so much in this area that I just don't want anyone to touch me. I just don't want to be touched there. And I've been told multiple things about how the pain blocker works. For some people, it works right away. By that night, you feel insane relief, like you didn't have anything wrong in the first place. I've heard that it can also take up to a week to take full effect, which is weird to think about, that you would go in, get a spinal injection, and then still kind of be in that pain for like 5 to 7 more days. I've also been told that the injection can last as little as a few weeks, or that it can last as long as 2 months. And in that time, you go to physical therapy and I'm to strengthen my core muscles around my spine and help to retrain my spine to fall into place, is the idea. So obviously I have this MRI done and I go have my pain management appointment and this is great. Like, we're not abandoning this. However, I really want to see my images with a doctor and have somebody confirm like how progressed this issue is. Since I have had this pain for 8 years, I'm just really worried that it's very bad. And I don't think that even with a spinal block in, making me do certain things in physical therapy is probably a horrible idea if it'll just hurt more when the spinal block wears off. So I'd like to look at the images. So I called my PCP when I got home and I made an appointment for this Friday at a doctor's office where I know that they will look at my images with me. This is the doctor's office where I went post x-ray for a second opinion and they sat with my x-rays in front of my face and talked to me about them. So that's the whole thing today. I did have a good experience with the younger doctor. The hospital where I go is a teaching hospital. There's the medical doctor that holds his license and runs the practice, and then there's students usually in their last year of med school. The student today was very kind and listened to me and heard my concerns. And even after the MD was done and walked out, the student came back and said to me, I know he asked you, did you have any more questions? And you said no, but do you have any more questions? Your face kind of looks like maybe you're not too sure. I just kind of unloaded on him and told him all about how, like, I knew that this was bad. And that I told doctors for months that I wanted to get this MRI and confirm it before they sent me into physical therapy, sight unseen. You know, here, go start lifting weights and I have herniated discs. Like, that's not a good idea. And there's no question in my mind that my back started going out because I was doing things I shouldn't be doing. And they would have known that had I gotten the MRI earlier. However, all that being said, this is how the medical system works. There wasn't another way that it would have worked out unless there was an emergency situation where I was in a real accident and wound up in the hospital with my back. It just had to be this way. These silly steps. See this doctor, then this doctor, talk to this guy, and then we'll send you over here. And then we can't go backwards, but we'll go sideways. You know, it's a lot to deal with. I'm very grateful and lucky for the friends that have allowed me to just chew their ear off with this shit. The people that are still willing to ask me how I'm doing every day, even though they know that the answer is probably gonna be, I feel like garbage. I'm bored, I'm stuck at home, I'm watching TV. Like, people can't even recommend shows to me anymore because I have watched Netflix. I'm done. I finished it. I finished the internet. I don't want to tell you any spoilers, but I'm done. All in all, today was a pretty good day. Thanks for listening, everybody. Everybody, whoever you are.